Welcome to Westmoreland Community Connections, a look at issues and happenings on Classic Hits 107.1 WHJB. Here now is your host, Chad Amond, President and CEO of the Westmoreland County Chamber of Commerce.
Hello and welcome to Westmoreland Community Connections. I'm your host, President and CEO of the Westmoreland County Chamber of Commerce, Chad Amond. I am honored and delighted to have on the show today Bob Rogalski. Bob is the CEO of Excela Health. Bob, thanks very much for being on the show.
Oh, thank you, Chad. Thanks for having me.
I guess we need to kick it off with give a little bit of your background. Give the listeners why you're passionate and leading Excela Health.
Yeah, I mean, I'm a Western Pennsylvania guy. I was born in Freeport and went to high school there. I went to St. Vincent College, and then I went to Pitt for law school, so it's about as Western Pennsylvania as you can get.
Right.
So I practiced in private practice for a little while, and then I've been in healthcare law ever since. So, starting with UPMC back in the 90s, and then did a stint with West Penn Allegheny as well, where you and I worked together, had the pleasure of working together.
Right.
So did a little bit of work in the upper Midwest in North Dakota, and then was lucky enough to come back home and have a chance to work with Excela Health as the CEO. So I'm passionate about healthcare. I have parents that access healthcare these days that are 80, and my mom is 77, so they frequent the facilities, and to me, the passion is taking care of friends, family, and neighbors.
Well, Excela Health is the largest employer in Westmoreland County and one of the largest employers in all of southwestern Pennsylvania. Your leadership has had tremendous impact on Westmoreland County, and so I thank you for that. One of the things is that all of the listeners, probably everyone, 100% of the listeners in the cars or driving around, or they're listening to the show today, we are struggling all across southwestern Pennsylvania and probably across the country with healthcare insurance. We're approaching, this time of year, we're approaching open enrollment for health benefits for the coming year, and there's a lot of concern in the community regarding where people can go for care based on what insurance they have. It's hard to cut through that noise. I mean, you're seeing all of the commercials from Highmark or UPMC, and what is happening, and how does that affect Excela Health?
Yeah, I mean, healthcare is expensive. I mean, there's no way around it. And it's our demographics to some degree. We have a lot of people who are pushing towards Medicare age, and including me in another decade here. And it's a huge bolus of baby boomers who are going to be coming through the system, and fewer workers to help pay for it the way we had 20 or 30 years ago. So it's really a financing issue that's hard to fight. We can't battle the demographics and some of the competition that's resulted as a result of the dollars getting tighter, have UPMC and Highmark building narrow networks that are both insurance companies and hospitals. Excela Health is going to stay away from that game. We've talked about that at the board level, and we want to make sure that Excela is open to everybody in Westmoreland County and surrounding counties. And we're going to maintain the ability to accept insurance from all the payers that are willing to work with us. So that's our goal, is to not put our patients through a choice they may not want to make, not have them have to switch doctors based on health plans, and that the change that could happen from their business switching, what insurance they carry based on cost. So we're just going to try and stay patient focused, and to us that should be a key leading advantage for us, is to make sure that people know that we can take care of them. You
brought up the aging demographic, and the chamber has been working on the comprehensive plan with the county in depth, and we know that in 2020, 28% of our population is going to be 65 or older. The situation seems particularly challenging in Westmoreland County, and it's not just Westmoreland County; it's all of southwestern Pennsylvania. But given the age of the population, how does the age of our community play in the healthcare discussion? Because I'm 44, so I'm not going to be on the Medicare for a couple of years, but it's almost 30, almost a third of the population, or at least a quarter of the population, is on the Medicare side. And how is that going to impact our population.
Yeah, I think the demand for healthcare services will be higher. We'll have people that more people we need to help take care of, but we're also going to be pressured to take care of them in a way that's more cost effective. We had a little bit more flexibility on cost when the demographics were different. Now I think we have to be very, very cautious with every healthcare dollar we spend. So we're going to get a lot of push to take care of people in ambulatory settings and not in expensive hospital settings and things like that. So, we built that into our strategy when we built the Excela Square at Latrobe and at Norwin and some of our other ambulatory facilities at Frick. So we've tried to make sure we have the ability to take care of ambulatory care first.
Well, you brought up the Norwin Square and the Latrobe Center. If you're listening and you haven't been to the Norwin or the Latrobe Center or Frick Hospital, you guys renovated Frick Hospital and it's beautiful. Outstanding.
Well, thank you. We tried to hit on all the key things. What would be the easiest for our patients? Free parking. Being able to drop off maybe an elderly patient or someone who had trouble walking, at the front door, and trying to make sure that people could get their primary care visit and a specialist visit at the same place, a lab test or an image. So we're just trying to make it really easy for the population to use us.
Well, getting back to the aging demographic and some things that people might not perceive is that it clearly impacts your workforce. You employ 5,000 or more employees?
Yeah, a little less than 5,000.
And so if those people are all in the county-ish, or I'm going to say they're probably residents of the county, most of them. If we have a quarter of, or almost a third of our population that is 65, that's retirement age, right? That is probably going to impact the workforce in Excela, right?
Yeah, I think that's a challenge for everybody right now, and it's not just Western Pennsylvania. That's a national trend also, but labor shortages, being able to staff healthcare appropriately is a concern for us. So we just have to be smart in the way we do things and try and work to be an employer of choice. In our nursing program, for example, we are pursuing the magnet designation, and that was a discipline that was used, that people studied what made nurses want to work at a facility and made them want to stay, and why did certain hospitals retain nurses when others didn't, and they came up with some of the core important reasons why nurses like to be at a facility, and they put that into a certification program. So we're pursuing the magnet status. We'll be surveyed for it here in the next several months, and really hope to achieve this high achievement.
You're listening to Westmoreland Community Connections on Hometown Classic Hits 107.1 WHJB. I'm your host, Chad Amond, president of the Westmoreland County Chamber of Commerce. Our guest today is Bob Rogalski, CEO of Excela Health. Bob is a graduate of St. Vincent College. He received his law degree from University of Pittsburgh and has been the CEO of Excela Health since 2010. Bob, one of the primary conversations that we probably need to have is about patient choice these days. Healthcare isn't the same as it was, choosing where you go for dinner or an event to watch. You can't be saying, well, I'm going to watch the Penguin game or I'm going to watch the Steeler game. It is about choosing your physicians and where you're closest to. Isn't that more complicated than that? Talk about the quality and the value here in Westmoreland County and what Excela Health is providing for the quality of care.
Yeah, it used to be that you just chose the physicians and you had a lot of ability to move between providers and health systems. That's not necessarily the case today. In some cases, you're picking an insurance plan, and then your options are a little bit more limited, a little more narrow. What we've always wanted to do is lead with quality. To us, quality of care was the most important. If you don't have that, you don't have anything really. So we've worked extremely hard, whether it was with Leapfrog or CMS Stars or no matter what agency was grading us on quality, to achieve the highest quality rankings that we could. And we've really ingrained that into our culture. So we've been extremely happy with the response and what our outcome measures have been. So couldn't be more proud of quality. And then, if you have that, the next thing you do is we work on access. And again, part of access for us is accepting all payers. So we want to take any of the difficult decisions that people sometimes feel forced against their will to make off the table, make it really easy for them to do business with Excela.
Obviously, UPMC and Allegheny Health Network and Highmark are impacting in many positive ways our all of southwestern Pennsylvania. How do you deal with this on a daily basis? Because obviously you want to work with them, you want to work with UPMC and Highmark, and how is this happening?
Right. Sometimes it feels like it's working pretty well, other times not. But for the most part, they're both high quality organizations. You and I both know from being in the city and working down there that they're good organizations. That being said, Excela is able to deliver really high quality care for really almost 85 or 90% of what people need. But there's always going to be certain things like liver transplants or things that we're not going to try and tackle in a community hospital setting. And for those, we need the partnerships with UPMC and we need the partnerships with Highmark and Allegheny. And at this point in the game, we have a lot of insurance enrollees who are coming to us. Almost half of our commercial insurance is still Highmark, and UPMC represents another large chunk of those patients that are coming to us, almost as much and growing every day. Right. So it's inevitable that we have partnerships with both of them. We're going to have competition. We acknowledge that. So there are going to be times where we're not going to be as happy about some of the decisions they make. But that's just being in the USA and having to deal with a competitive environment versus one that's more constrained.
Right. We're going to talk about the competition when we return. You're listening to Westmoreland Community Connections on Hometown Classic Hits 107.1 WHJB. We'll be right back after these messages.
This is Westmoreland Community Connections on Classic Hits 107.1 WHJB. If you have a suggestion for a topic, or if your nonprofit organization would like to be featured on this program, call us during regular business hours at 724-216-1200.
Welcome back. You're listening to Westmoreland Community Connections on Hometown Classic Hits 107.1 WHJB. I'm your host, Chad Amond, President and CEO of the Westmoreland County Chamber of Commerce. Our guest today is Bob Rogalski, CEO of Excela Health. Bob, before we went to the break, we were talking about competition. And obviously, competition is a good thing in many industries. If you're a manufacturer, it's increasing your productivity. But in healthcare, it's a little bit of a different scenario. Is competition good no matter what in healthcare? And explain that to the listeners. I mean, one thing is that obviously, UPMC and Highmark and Allegheny Health Network they're battling. I think that's pretty safe to say. But how is that impacting southwestern Pennsylvania, and what is your perspective on that?
Sure. I do think in general that competition is good in almost everything, even in healthcare settings. It'll force providers to work on patient access and patient satisfaction in ways that if there were not competition, it wouldn't impact. So in general, I think it's good. I just want everyone to be aware of the side effect of it to some degree because it's different than a lot of other economic models. Patients may have some co-pays, but in general don't pay for the entire cost of health care. So, one of the side effects, if you build too rapidly, add too much infrastructure, add too many facilities, is you can increase the cost for the people who are paying for health insurance. So that's the caution. In the old days, they had certificate of need to address that, where the state would look at it and determine whether or not they were expanding too rapidly because they were concerned about cost, because the government was paying for such a substantial portion of health care. We don't have that today. It's been out of the law since 1996. So there was recently an article in the Denver newspapers where they've had unprecedented building, and I think the lead of that story was that it's led to unprecedented rise in cost in the area to the health insurance community and employers, double-digit increases. So they're actually taking a look at certificate of need again. So that's the caution. When you already have a lot of empty beds, which we do in Western Pennsylvania just because of the way our population has trended over the last couple of decades, that if you add a big building spree on top of it, the concern is that we could be adding cost to the overall system.
So the certificate of need would be that if Excela wanted to build a new hospital, they would have to go to the state government and say, hey, this is really needed, and the state would say, okay, I understand. That is not in the current environment.
That's correct. Many states still have it. Pennsylvania has not here for a while. And don't get me wrong, I don't advocate for it. There were flaws in the certificate of need process that, in some ways made it difficult for certain institutions to get things done. It was sometimes viewed as political, and based on what sort of influence you had in Harrisburg may have been a better way.
That never happens, right?
Right. Reality never gets in the way, right? So I'm not an advocate for it. I just think that when we see a huge expansion, which we are seeing right now, people need to be mindful of cost and just keep the heat on the large insurance companies to keep costs down.
Well, you are impacting the community in numerous ways, and you're dealing with the competition. But how successful is Excela in meeting the health needs of the community, and what are some of the challenges? We can talk. Obviously this show is always about the positive impacts, but let us the listeners know what are some of the challenges that maybe they can help to advocate for.
Sure. One of the things I'm very proud of is that we've been able to build an incredibly strong primary care base with a lot of high-quality primary care physicians. We have a very strong family practice residency program. And when we do some polling in our community, the majority of people want to make sure they have strong primary care close to home. So I think we've been able to establish that for the community and meet that need. And that'll carry over into some of the key areas that we're trying to manage that we measure through our community health needs assessment. So, whether it's, high blood pressure, whether it's obesity, whether it is some work that we do in behavioral health and depression type screening, some of those key areas which carry over into devastating areas like opioid addiction. I think our primary care docs are on the front lines and are trying to solve a lot of those problems for the community. Very proud of what they do in the CMS STAR score for population health, and that's a measure that Medicare measures us to see, are you taking care of the right types of treatments for these different disease states? And they measure our whole population. Did you measure everyone's diabetes appropriately? Did you control their high blood pressure appropriately? And then they grade us on it, and we do really, really well in that area. So in terms of meeting the basic needs of the community, I feel really proud of what we're doing at Excela Health. And again, I think over the last 6 or 7 years, we've been able to build some high-quality specialty services to go with it, too, carrying on from some of the great work that was done by my predecessors, too. This is a building on really good work that was done before I got here. But a thoracic surgery program to take care of lung surgery, or lung cancer, rather, let me say it that way. is something we've built that I'm proud of. And, just continuing to add to our ability to keep care convenient for people in our communities.
So those are some of the key impacts. What are some of the challenges that you expect over the next couple of years, or maybe the challenges that you're dealing with right now, and it's going to maybe those are going to be the things that you're going to have to focus on and work to correct?
Yeah, I worry about a couple of things. The opioid crisis is difficult. We've tried to establish policies that are very strict in terms of how to address those type of patients. I mean, it's an epidemic, as we've all seen in the newspaper. And, we've tried to establish a chronic pain management service with board-certified pain management physicians who are willing to handle chronic pain patients. And our primary care docs, again, are key in building to take care of that issue. And try to have the right sort of controls and discipline to make sure we don't have issues where prescriptions are being delivered in a way that's inappropriate. But what we do in our community health needs assessment is we every 3 years or so measure what we think the most critical needs are for the community, and then we come up with action plans to address them. And if anybody wants to, they can go on our website at Excela Health, and they can take a survey, and they can contribute and tell us what they think the most pressing issues are. So I would welcome anybody to just log on and tell us what they think.
Yeah, and I'm proud to serve on the steering committee for the Community Health Needs Assessment. If you are listening and you want to go on and take this survey, you can go on to excelahealth.org. That's excelahealth.org, and take the survey for the Community Health Needs Assessment. Bob, one of the things that some people don't understand, and it's the impact that the healthcare has on our local economy. We talked about the number of jobs that Excela has and the number of locations, and you've expanded over the last probably the decade. How have you grown, and how do you see the growth continuing over the next couple of years?
Yeah, we've done a lot of consolidations, so there's an appearance of growth, both at Excela Square at Latrobe, Excela Square at Frick, but we've taken, I think we had 70-some sites for primary care practices and specialty offices in the county, and we're trying to contract that.
Okay.
Yeah, so much of it is consolidation that we're seeing, which we're trying to do to become more efficient and get enough scale to provide more things to the public in a more efficient way. The expansion that we have seen is really in the number of people we take care of across the county. So, we were counting up our patient panel size. There's over 100,000 people that have registered with a primary care physician at Excela. So that expansion I'm very proud of. We've seen contraction in other areas. Inpatient admissions continue to decline in the region. So, the overall, the expansion I like to see is that we're taking care of more people that live here in the community and doing it in the ways I mentioned, trying to screen them for diabetes and the things that are going to affect their long-term health.
One of those things what you mentioned as consolidation, we sometimes perceive that as growth because we're hearing at the chamber that the patients that are going to Norwin Square or the Latrobe Center, they're fascinated with the ease that they go and they see one doctor and then they can walk across the hall and see the other one that they're referred to. So that's a positive impact. Excela has a lot to be proud of. Anything that you want to make sure that the listeners are seeing that you are proud of and that you and your staff are proud of?
Yeah, the squares, of course, we are proud of. In the old days, you would go to a primary care office and then you'd get a referral to a specialist, and then you would search around and, try and figure out which specialist you wanted to go to. And you might go to a specialist who didn't have access to your medical records. And, I think one of the things we've been able to do is make it easier, not just for the patients, but for the specialists to see what the primary care docs have worked on, what they've prescribed, whether or not what they're going to prescribe fits with what was done in the past. So, I am proud of a lot of that work in the consolidations we've done, because they were done to aim for quality and patient convenience. But when I look at the landscape of what I'm most proud of, I really do think we've established a culture of safety and quality. So I could walk through almost any hall in the hospital at one of our squares and say, what's our number one priority? And someone would say, quality of care, patient satisfaction. It's very patient-centered. And I see it in our scores, So most recently, the Leapfrog Group awarded, again, Latrobe Hospital got an A, and Westmoreland got a high B. So I feel really good about that, and those results that we keep working on, whether it's the Medicare program or some of the people we purchase quality data from the CareChecks group, see us as a really high quality system. And in fact, we just looked at the update in CareChecks, and they pull their data from Medicare. And for patient safety, Excela Health as a system is in the top 20 in the United States.
Wow, great. Well, you're listening to Westmoreland Community Connections on Hometown Classic Hits 107.1 WHJB. We're talking with Bob Rogalski. He is the CEO of Excela Health. Bob, I obviously know that you don't have the crystal ball, but where do you see healthcare going in the next couple of years? Obviously, there is going to be a micro hospital that Allegheny Health Network is building in Hempfield Township. We are having a declining population. Is it difficult to recruit physicians? So, where do you see the healthcare industry going in the next couple of years?
Yeah, I think it's going to be tough work for all of the healthcare systems, for sure. I didn't think it was easy, though, 20 years ago either, right. When we were doing it together. Yeah, so, I do think that it is difficult to recruit for a lot of positions. I mentioned the labor shortage, and physicians' labor is included in that. So it's going to be a challenge to keep moving forward with high-quality physicians. I'm thankful we have the residency program. I'm very confident for primary care that we'll be able to keep that staffed appropriately for the county. So that part's a good element for Excela Health. I think there will be increased competition. I'm very anxious to see what happens, probably like everybody in Western Pennsylvania, what happens with UPMC and Highmark after the expiration of the consent decree this coming year. So, we're moving towards a community that has a couple of narrow networks in it, which isn't unlike some other parts of the country. So I don't view it as exceptional, or I'm not being critical of either organization. I do think what will happen, though, is the increased competition will probably force a little more consolidation. And it'll be interesting to see if some of the national insurance companies who present themselves to the market as being able to provide the open access that people were used to, whether they emerge. Are people going to turn to Aetna or United or somebody else and say, that'll make it easier for me than trying to choose between Highmark and UPMC?
Well, we will judge the crystal ball in the next couple of years. Bob Rogalski, CEO of Excela Health. Thanks very much for being on Westmoreland Community Connections.
Yeah, thank you, Chad. It was my pleasure.
If you want to go on to take the survey for the Community Health Needs Assessment, go on to excelahealth.org. That's excelahealth.org. If you want to reach Excela Health, call them at 1-877-771-1234. That's 877-771-1234. You've been listening to Westmoreland Community Connections on Hometown Classic Hits 107.1 WHJB. Join us next week, same time, same place, for another edition of Westmoreland Community Connections. Thanks for listening, everyone.
This has been Westmoreland Community Connections, a look at issues and happenings in and around Westmoreland County. Join us again next week on Classic Hits 107.1 WHJB.